So that's my plan for you. I've just finished refracting you. I'll do a test for you now so we can see your best potential. And for doctors watching, it's a wonderful patient who's traveled all the way from Chicago. She has retinitis pigmentosa and amblyopia in both eyes, meaning lazy eye, cannot see beyond a certain level, and very high nearsightedness and astigmatism. And I have refracted her. I have got my refraction. She's not a 20/20 candidate. So even though they all come to me with a desire to proceed, I spend hours. How many hours have I spent with you?
A lot, doctor.
Approximately.
4 or 5?
Since morning. And every patient who's landing, I'm with them hours and hours refracting, because I also want to make sure we're doing the right decision and that they understand what I'm doing and the options they have, right? So take off your glasses for a minute. Look at your mother, okay? Quick. Look at her. Ready? Now look through this. Give me a number 1 to 10.
9.
At least?
Yeah.
Why?
At least.
So doctors, what I'm doing is looking also by integrity to see, is it worth doing surgery? Is it worth doing surgery, letting her spend and do surgery? Is it worth it? Once they give me more than 7 and 8, I'm okay in these amblyopic patients, because that means such a young patient can be set free into the world, right? As opposed to being around. Now, can you summarize for me what I said? So as I told you, you have retinitis pigmentosa, you know that
Yes.
from your doctor in Chicago.
Yes.
Your lazy eye, you don't improve beyond 20/80 vision.
Yes.
Why should I proceed?
So I could see everything better and not use glasses, more comfortable.
And you understand the guarded prognosis, right? Second important thing also, doctor, because they're not from out of country, I'm letting them proceed with one eye at a time so they can see the result and then proceed. So 1 eye or 2 eyes?
2 eye, please. Sir.
Why?
It's just better for me, more convenient.
So doctors, very important, please, spend this energy and time with them. They all come here with very, very complex situations, but ethically also I want to be right and very strictly right before I proceed with them. I will do that for you.
Thank you.
Pleasure.
Thank
See,
you.
now these technologies, she does have high astigmatism, very high myopia. We can see though that even though it's RP, the lens is most likely clear in this case. We do have relatively thin cornea with high regular astigmatism. And when I image them on a high definition, again, very clear system optically. So her amblyopia is real, and we want to see if we can still help her with LaZrPlastique and bring her to vision to that point that she's free, knowing that she's not 20/20, but will that change her life? And it's worth doing it, right?
Yes.
Okay?
Thank you so much.
My pleasure again. Yes, you're from Turkey, right?
Yes,
You and
we are.
Mom, all of you.
Yes.
So, are you clear about my plan now?
Yes, sir.
Any questions?
No? We can get started. Hadi.
I'll see you. I'll see you.
Doctor.
Come on. Enough fun for one day?
Basic eye surgery, and he said, "Oh, if you have it yourself, you can go swim at the pool or whatever," which is not true. I mean, I'm a nurse graduate myself, and I know that's not the
No,
right.
please, especially your complex case. No, I'll let you go to Turkey later, but not now.
Yeah,
No, please, careful. Okay, wonderful. So you understand the plan that we're making now?
Yes.
Yes. So again, doctors, you're watching patients from all over the world, and how, to me, not only are they coming with so much trust and hope and faith and just waiting to go, raring to go, I actually stop them and I review not only the medical complexity, but expectations, prognosis, and more important, my own ethics. Should I even say yes? So though to me no case is complex, I want always patients to understand that they are part of my team, right? So we see the ethical side of them. How many hours have I spent with you today?
Oh my God. I've
Just
been,
approximately.
5.
Wonderful. So doctors, very important, please. Every patient of mine, every patient, amazing, intense, very brilliant. They've full knowledge, taught me for years, referred by their surgeons for a reason, and here they are. So we'll quickly wrap this up for you. Here's a wonderful patient. If you see the imaging on this patient has over 30 cut radial keratotomy with LASIK, with refractive surgeries, with pseudo exfoliation on the lens, with fused dystrophy of the cornea, with a very hard cataract with weak zonules in the eye, and high hyperopia, shallow chamber, very high regular astigmatism, over 12 diopters. So again, everything here is going to work against you. There are over 30 cuts, radial keratotomy all the way, as you can see here. Additionally, there's a LASIK flap on top of it, instability. Under that, the cornea has fused dystrophy, which looks like this. You can see this entire area nearly wiped out compared to the normal area here. All right. And so the front and back of the cornea, that's the issue, along with high regular astigmatism, very dense cataract, pseudo-exfoliation you can see here, pupil very poorly dilating. We have to go through all this and see what we can do for keratotomy, cuts fully scarred, very dense cataract, small pupil, pseudo-exfoliation area, very high regular astigmatism, over 12 diopters that you can see here. All this is an impact to where we are headed and how challenging the case will be, only because you as a doctor should want everything that you can give this patient more than the patients want, right? So very, very important to do all that aspect in these cases. Very important. And it's important that the patient understand after all these evaluations that I've done today and discussions of where we are headed. So in a nutshell, describe your case, man. Nutshell.
A mess. It's a mess.
And what have other doctors suggested for you? Anybody?
There has been no suggestion. Well, actually, it's not true. It was recommended that I come see you.
So very important, doctors, again, not only do you be a doctor, but you also become family. Help them take personal decisions. Is it worth their travel? Is it worth spending money and doing surgery? What to expect in these cases? My fight, 100%. There is no absolutely no doubt about it, but I want them to be clear that this is not some, what do you call it? What word am I looking for? It's not magic. It's not easy. It is something that I want to fight for everything you all are, no matter how complex the situation is.
And I appreciate that.
Pleasure.
And thank you.
Absolutely. Did you understand the plan now?
Yes, it's clear.
Wonderful. So tell me, what's the plan? Summarize. So for doctors watching, you're seeing me all day with patients from all over the world, how I sit down. Not only do I accept them, have reviewed their doctor's notes on the weekend before they even fly in, and then I'm also taking charge as family to make a decision, because they are ready to roll, but I want to make sure they understand their prognosis and what I'm doing. Here's a wonderful gentleman with not only radial keratotomy cuts you can see here, but also Ruiz astigmatic keratotomy, the step ladder cuts with about 12 diopter astigmatism, irregular astigmatism, and full thickness central scar with cataract. Obviously vision is very poor. You can see the whole density of the lens cataract and a full thickness corneal scar, very high regular astigmatism going on. And what I'm going to do here is plan for him a surgery that I work through the lens first in his case, come out with the lens case, and then go and perform surgery and correct the cornea. So if you see that case, again, I have spent how many hours with you already?
How many hours? 2 hours or 3 hours?
At least
Yeah.
today itself. Planning, reviewing, explaining, simulating, and you understand your plan then, right?
Yes.
So again, very guarded prognosis. He fully understands your herpes can come back. Your surgeons, your surgeons who refer you to me are not wrong. Transplant is what the book says. But also, since you need cataract, given that is also going on, I believe LaZrPlastique would be the technique I would proceed with. So we get that done. We are moving north anyways, and then correct the corneal part of it. This way we let your eye use its maximum potential. Again, you're fully aware of the prognosis, Paul?
Yes.
No 20/20, no guarantees of outcome. Your herpes can come back and damage all the work, but that's the direction.
I understand that. Yeah.
Any questions?
No, I'm clear.
Ready?
Yes.
Pleasure. Excellent. So everything looked great. How do you feel about the left eye that we did?
I feel better, doctor. Yeah.
Yes?
Yeah, my close-up is better. The reading is better.
And both eyes working together.
Both eyes working together with the brain. Yes.
So doctors, y'all have been watching all day some of the patients we've been sharing with y'all. How not only do I spend hours with them, how many hours did I spend with you again, Sean?
Quite a bit.
Measuring, remeasuring. These are cases that come from all over the world. Gentlemen have come to me with very high latent hyperopia, and you've been to how many countries for this?
Dominican Republic, Germany, Russia, LA.
And what was the options you were given?
Glasses.
And how do you feel after the LaZrPlastique we did?
I feel better in my left eye, yes.
So we've done his first eye, doing excellent. Both eyes are now working in sync. 3D's back, both eyes. And even though he came today to do his right eye, which is also latent hyperopia, my suggestion after the evaluation is not to proceed, because both eyes are doing so well together, right?
Yes.
And you can always come back to me 6 months later and I can take that eye from 2022 further if you need. But today I feel after all the evaluation, let's not proceed with your right eye. Left eye is doing so super with the surgery. Both are working together. Anything you want to say to doctors?
I trust you, doctor. I trust the process. If you say we wait, we come back.
That's because how are you seeing? How's the distance and here? Both?
We're good.
Free.
Good, yes.
Right?
Yeah, good. Everything is good. Thank you very much, doctor.
Pleasure. All the
Thank you.
pleasure. Come back 6 months. I promise we'll do your right eye too.
Doctor, I brought some cognac for you since I know you like whiskey or cognac. Excellent. It's for you. Enjoy it. Drink it.
And then operate on you.
Yeah.
You guys y'all are my gifts already, man. Just seeing y'all doing so well. You've already given me this. This is
Thank you so
amazing.
much. I appreciate your work. I appreciate what you do for the patients.
My pleasure. All of you guys. So much stuff for my weekend.
Thank you.
My pleasure again. Do well. Safe travels back. I'll see you back in 6 months. Right? Take care. My pleasure.